Have you ever sitting on your couch watching TV or maybe just driving home from work when suddenly out of nowhere your heart starts pounding like a drum, your chest tightens, you can't catch your breath, and a wave of sheer terror washes over you? Your mind starts racing. Is it a heart attack? Am I dying? Am I crazy? If this sounds familiar, you are not alone. What you're likely experiencing is a panic attack. And today, we're not just going to talk about it in medical terms. We're going to give you a practical, step-by-step toolkit, what to do in the moment an attack hits, and what you can do in your daily life to take back control. Stick with me, because by the end of this video you will have a powerful understanding of your body's alarm system and exactly how to calm it down. My name is Dr. Jamalvandi and welcome to my channel. What is a panic attack really? Before we get to the what to do, let's quickly understand the what is. A panic attack is not a sign of weakness or a character flaw. It is a sudden, intense surge of fear that triggers severe physical reactions when there is no real danger or apparent cause. Think of it like a false alarm from your body's built-in survival system, the fight or flight response. This system is brilliant when you're facing a real threat, like a speeding car. It floods your body with adrenaline to help you react quickly. But with a panic attack, this alarm goes off when there is no fire. It's a malfunction of a perfectly good system. Understanding this is the first step to removing the fear around the attack itself. What does a panic attack feel like? The symptoms. Now let's describe the experience. I'm going to list the common symptoms. I want to nod along if any of this sounds familiar. This is crucial because recognizing it for what it is, a panic attack, is your first tool against it. The heart. Your heart pounds, palpitates, or races. It can feel like it's breathing out of your chest. Breathing. You feel short of breath, smoother, or like you're choking. It might feel like you can't get a full, satisfying breath. The chest. Chest pain or discomfort is very common. This is why so many people end up in the emergency room convinced it's a heart attack. Trembling or shaking. Your body is flooded with energy it doesn't know how to use, so you might tremble or shake uncontrollably. Sweating and chills. You might break out in a cold sweat or experience sudden chills or hot flashes. And next one is dizziness and derealization. This is a big one. You might feel dizzy, lightheaded, or faint. Many people describe a feeling of unreality, like you're detached from yourself or your surrounding, as if you're in a dream. This is called the realization or depersonalization, and it's terrifying, but it's a direct result of the hyperventilation and adrenaline. Gastrointestinal upset, nausea, or stomach cramps can occur. The mind, a sense of impending doom or a fear of losing control, going crazy, or even dying. The key here is that these symptoms peak within minutes. They feel eternal when you're in it, but they will subside. What to do in the moment? Okay, the attack has started. The wave of terror is hitting you. What do you do right now? Your goal is not to fight the panic. Your goal is to ride the wave until it passes. Here is your step-by-step action plan. Step 1. Acknowledge and label. The very first thing to do is to say to yourself out loud, if you can, this is a panic attack. It is not dangerous. It is uncomfortable, but it will pass. This simple act of labeling separates you from the experience. You are not the panic. You are someone experiencing a temporary state. This reduces the secondary fear and fear of the fear. Step 2. Ground yourself in the present. The 5, 4, 3, 2, 1 method. When panic hits, your mind is in the future or detached from reality. We need to bring it back to the present, to what is real right now. Use the 5, 4, 3, 2, 1 techniques. Name 5 things you can see around you. For example, I see my blue couch, a lamp, a book with a red cover, a speck of dust in the table, my own hands. All of them can be remind. Name 4 things you can feel. For example, I feel the fabric of my shirt, the cool floor under my feet, the chair supporting my back, the air on my skin. Name 3 things you can hear. For example, I hear the hum of the refrigerator, bird outside, the sound of my own breathing. And name 2 things you can smell. For example, I smell the laundry detergent on my clothes, the faint scent of coffee. And finally, name 1 thing you can taste. For example, I can taste the last sip of water I had. This forces your brain to focus on sensory input, pulling you out of the panic spiral. Step 3. Regulate your breathing, the physiological side. When we panic, we hyperventilate, taking short, shallow breaths. This worsens dizziness and chest tightness. We need to slow it down. I'm going to teach you a very effective technique called the physiological sigh. Take a normal inhale through your nose. Now, without exhaling, take a second, shorter inhale to fully fill your lungs. Then exhale slowly and fully through your mouth, making a soft like this. Make the exhale longer than the inhale. Do this 3 to 5 times. This is incredibly powerful for rapidly calming your nervous system. Step 4. Don't fight it. Let the wave pass. Tensing up and fighting the sensations only tells your brain the threat is real. Instead, try this counter-intuitive approach. If you feel tension in your chest, don't clench against it. Mentally, try to make a space for the sensation. Say, okay, tension, you can be here. I'm not going to fight you. This attitude of acceptance can dramatically shorten the attack's duration. Step 5. Use temperature, if possible. A quick change in temperature can shock your system back to the present. Hold an ice cube in your hand, splash cold water on your face, or if you're at home, hold a cold can of soda against your wrist or neck. This can help ground you. Long-term strategy, rewriting your system to reduce attacks. Managing the moment is essential, but the real freedom comes from reducing the frequency and intensity of attacks over time. This is about teaching your nervous system to be less reactive. 1. Regular breathing practice. This is the foundation. Don't wait for a panic attack to practice breathing. Spend 5 to 10 minutes each day doing deep diaphragmatic breathing. Lie down, place a hand on your belly and breathe in deeply so your belly rises, then exhale slowly. This trains your body to stay in a calmer state. Regular physical activity. Exercise is nature's anxiety medication. It burns off excess adrenaline and stress hormones and releases endorphins, the body's natural mood elevators. You don't need to run a marathon. A daily 30-minute brisk walk can work wonders. Mindfulness and meditation. This like a strength training for your ability to observe your thoughts without getting swept away by them. Apps like Calm or Headspace have great guided meditations. Start with just 5 minutes a day. This builds the muscle of present moment awareness. Identify the managed triggers. Keep a simple journal. After an attack, Note what was happening beforehand. Were you stressed about work? Did you have too much coffee? Not enough sleep? Over time, patterns may emerge, allowing you to address the root causes. Limit stimulants. Caffeine, nicotine, and even sugar can mimic the symptoms of anxiety and trigger panic attacks in sensitive individuals. Try reducing your intake and see if it makes a difference. Prioritize sleep. Sleep deprivation is a major trigger for anxiety. Aim for 7 to 9 hours of quality sleep per night. This is non-negotiable for mental health. Professional help is a sign of strength. If panic attacks are significantly impacting your life, please consider seeking therapy. Cognitive behavior therapy is highly effective for panic disorder. It helps you change the thought patterns that fuel the attacks. Medication can also be a very helpful tool for some people to get back on track. There is zero shame in seeking help. So let's do a quick recap. When a panic attack strikes, acknowledge it. This is a panic attack. Ground yourself using the 5, 4, 3, 2, 1 method. Breathe using the physiological sigh. Allow the sensation to be there without fighting it. And for the long term, build your resilience with daily breathing, exercise, mindfulness, and good sleep. Remember, you are not broken. Your body's alarm system is just a little too sensitive, and just like any system, it can be recalibrated. It takes practice and patience, but you can absolutely get to a point where panic no longer controls your life. Final thought, if you take one thing from this video, let it be this. The fear of the next panic attack is often worse than the attack itself. By learning these tools, you are taking away that fear. You are becoming the expert of your own experience. Thank you for watching. If this was helpful, please give it a thumb up and subscribe to the channel for more practical health advice. And I'd love to hear from you in the comments below what strategies you worked for you. Take care of yourselves.